Module 2, Behaviors of Individuals with Dementia. Part 1, Recognizing Challenging Behaviors. As mentioned in Module 1, Introduction to Dementia, there are a variety of cognitive, social, emotional, and functional challenges that may emerge. Because the disease is progressive, much of the time, especially in the earlier stages, the individual is aware of the declining cognition and function, leading to a multitude of feelings and actions. When addressing behaviors, each situation and individual are different. However, there are common signs or actions that can help you recognize the issue. Trouble communicating clearly. What it looks like. May become agitated if they cannot figure out what you are trying to tell them or do, or can't find the right words to tell you what they want. What you see are actions that cry out emotions that this person is feeling. Response. Respond to the emotion that is being communicated rather than the behavior. When giving instructions, break down what you are asking into one simple step at a time. Unfamiliar environment. What it looks like. Different environment, change in staff, or location that the person is unable to recognize can cause troubling behaviors. They may act nervous and upset. They may pick up their clothes, wring their hands, cry, create accusations, or choose repetitive behaviors or words. The repetitive behavior or words may be a way the person is looking for security and or familiarity. Response. Do not try to reason or correct. Listen to what is troubling the person and try to understand their reality. Be reassuring and let them know you care. They are safe and that you will stay with them until they feel better. Offer to find whatever was lost. If there is an accusation of theft, repeat the answer if a question is asked again, or try distraction to a different activity or topic. Overstimulating environment. Too many people, too much noise, loud colors in the environment, shadow rooms, or excessive clutter can lead to agitation, hallucinations, or aggressive behaviors. Response. Stay calm and stay an arm's length away if safety is a concern. Provide reassurance and encourage the person to go with you to another place where it is well lit, quiet, and calming. Be sensitive to the feeling that may be causing this behavior, such as fear or worry. Physical discomfort. What it looks like. May come about due to illness, medication side effect, or other facts, but the individual may not be able to communicate clearly about their discomfort and may try to get the message across through their behavior. Response. Check for pain, hunger, thirst, constipation, full bladder, or tiredness. Also check to see if their clothes may be too tight or too loose. If medication side effects are the suspected cause of discomfort, contact the doctor. Frustration with tasks. When trying to accomplish a task or chore that has multiple steps or seems complicated to the individual, then strong reactions can occur. Stay calm and be patient. Repeat instructions one step at a time. Say statements such as, "Do as much as you can and I will help you." If trouble continues, do not persist in making the person perform the activity, but rather move on to a different one. Tiredness. What it looks like. Agitation, fear, repetitive behaviors, and many other troubling yet typical behaviors associated with dementia can occur when a person is feeling run down and tired. Response. Use a quiet tone of voice and encourage some rest time. Boredom. What it looks like. A person may choose repetitive behaviors if they are bored or understimulated. Response. Turn a repetitive action or behavior into an activity. For example, if she's rubbing her hands across a table, give her a cloth and ask her to help with dusting. Other simple tasks that can help a person feel useful are winding a ball of yarn or stacking magazines. Try using art, music, or touch to help them relax. Pull out a memory book or treasure box you've made together. Use the pictures or items to talk about good memories. Take a walk, play ball, or go for a car ride. Additionally, we have listed some do's and don'ts of interaction that can help you with any situation or episode of behavior. Do. Back off and ask permission. Use calm, positive statements. Reassure, slow down. Use visual or verbal cues. Add light. Offer guided choices between two options. Focus on pleasant events. Offer simple exercise options or limit stimulation. Do not raise your voice. Take offense. Corner, crowd, restrain, rush. Criticize, ignore, confront. Argue, disagree, reason, shame, demand, condescend, force, explain, teach, show alarm, or make sudden movements out of the person's view. Say, "May I help you? You're safe here. Everything is under control. I apologize. I'm sorry that you are upset. I know it's hard. I will stay until you feel better." It is important that you are not talking down or infantilizing individuals. You should treat them with respect and dignity. The more rapport you have with an individual, the easier it will be to calm or redirect them. Remember to give them choices, communicate with easy to understand languages, and relate to what they are feeling. We included an easy worksheet that you can create for the individuals at the program. This information can better help you understand and engage with the individual. Additionally, we have included a few examples to address different behaviors such as disengagement, eloping, aggression, and memory challenges that can occur or get out of hand. Part 2. Signs of overstimulation. What is overstimulation and how does it affect an individual with dementia? Overstimulation, or sensory overload, is when your senses are just completely overloaded with information, making it difficult, or sometimes near impossible, to fully process the information you are receiving. When someone is feeling overstimulated or overwhelmed, a stress response is triggered. Feeling stress can occur for a number of reasons, and when a person is vulnerable and unable to modulate how they feel, they can experience or display anxiety, agitation, or aggression. A few characteristics of overstimulation are confusion, boredom, self-harm, irritability, mood changes, eloping, and withdrawal. What is understimulation, and how does it affect an individual with dementia? Understimulation refers to those times when your brain isn't receiving enough sensory input to keep you engaged with your surroundings. This can be displayed as decreased or trouble with attention span, increased stress, increased anxiety, and depression. We've provided a handout that provides an example to help calm an individual who is overstimulated or alert an individual who is understimulated. This list is not exhaustive. It is important to tailor the sensory stimulation to the individual. Scents and sounds can bring back both positive and negative memories. Keep a little checklist in their folder with preferences and what does and does not work to calm or alert them.